Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. Today we were talking with Nick Moriello, president of Highmark Blue Cross Blue Shield of Delaware, about the need to improve the healthcare experience for the consumer amongst the complicated web of different consumers in healthcare. But first, who are we and why are we here? And why did we name our show the Reverse Mullet Healthcare Podcast?
So we could get these mugs with the Mullet Podcast. It's because we want to be relevant, informative, and creative, but we also want to be entertaining and have fun. Business in the front. Party in the front, business in the back. It's a reverse mullet.
Yes, you're confused by the Super Bowl commercial
Exactly.
this year with the actual mullet.
Exactly.
No, party in the front, business
in the back.
We are your hosts, Justin Politi,
Ellen Brown,
and Dave Pavlik. We are passionate, innovative, and collaborative, and we are committed to solving our industry's most important issues together with our clients. We have a combined 90 years experience.
And I think if we added Nick into that, we would make it over the century mark.
There you go.
Pretty
It
close.
makes us sound
Most
really
likely. Yeah, that
makes us
does make
sound
it
really
now.
old.
Sounds right. In each episode, we're going to dig into a hot healthcare topic and dig into each other.
Just be gentle on me.
We've already...
Yep.
Noogies?
No noogies. Well, thank God we haven't done the noogie
Yeah,
yet.
I know.
I'm kind of
I was
scared
gonna
that
do
one
noogies
day.
after the
Were you?
last episode
well, because I
because you
gave
were
you
giving me so much flack.
Yeah, well, it was like your client crush. It's like his bestie.
Yeah.
So it was very exciting. Like we all have our favorites sometimes, and that was. It was very special for Justin.
Nick's the favorite.
No, Nick's one of my favorites, so I'm super excited.
All right.
So today
It's been
we
a Delaware
get to,
day.
It
Sorry,
is.
Dave.
Well, that's why we flew up here.
Yeah.
It's kind of why we're here.
Yeah. Now I'm putting two and two together.
Are you?
Yes.
It took you a while. It took you
You
till
know what
the
I'm
third
feeling
episode.
today is like one of those lights that takes a little while to
Yeah.
brighten
It's because
up.
you're coming down off of the high.
Yes, that's right.
Yes, exactly. But today we get to talk with Nick, president of Highmark Blue Cross Blue Shield of Delaware, where he has left quite an impressive legacy during his tenure. He has steered Highmark through both a financial and cultural transformation that has led to exceeding financial goals every year for all major segments while achieving an all-time high of health plan membership, so I spent 10 years on the health plan space. It was actually, so I was down the road when CareFirst acquired Blue Cross Blue Shield of Delaware. That has since obviously changed a lot, but in that time frame. And I can tell you, for anybody that doesn't know the health plan side, to achieve that type of financial success, cultural success, and growth simultaneously is pretty impressive and unheard of on the health plan space. So wait, give me the sound effect. There we go. There you go, Nick. There you go. So
Awesome.
sorry. So anyways, at the same time, Highmark has been recognized as a top place to work in the U.S. the past 2 years, receiving perfect scores on the Human Rights Campaign's Corporate Equality Index for 4 consecutive years. But yet you aren't the typical lifetime health plan CEO. Prior to Highmark, you were the founder and successful entrepreneur who twice built and sold businesses to strategic buyers and investors. Both of those businesses were health insurance agencies, which is on the distribution side of health insurance, which gave you a very unique lens into healthcare. Not to be overlooked is also your commitment to relationships, which is why we've stayed in touch, and it's why I think part of the connection that we all had when we first met. This also includes collaborations across the healthcare provider and payer divide, as well as not-for-profit board work in a variety of roles, and your leadership of Blueprints for the Community, a fund that has deployed $10 million in 2022 alone for improving healthcare access, economic stability for families and individuals, mental health, environmental health, and the upskilling of the health-related workforce.
Very impressive.
Yes.
I have to ask a quick question. I don't want to derail, but I worked at Blue Cross Blue Shield of the National Capital Area when CareFirst bought that plan. How did I not know that they bought Delaware? When did that happen?
Right after. So it was like a buying frenzy.
Okay.
Yeah. Well, I mean, I was there when...
I guess I wasn't paying attention.
No, but I was there during that too. See, we actually worked for the same entity and didn't even realize it,
Yeah,
Dave.
I know.
It was a precursor, so...
Yeah.
So, Nick, it's great to have you here. We are lucky enough to meet a lot of people, But when we had to interview you a couple of years ago as part of a client engagement, you really stood out to us as someone who really values relationships. So we're real excited to have you here today.
Thank you. Thanks for having me.
So first, because now we get to have the party in the front.
I love that.
So yes. So can you share with us and with our listeners of something unexpected about yourself?
Yeah, it would be unexpected for folks who don't know me.
Okay.
For folks who do know me, it's no surprise at all that I am a connoisseur of sweets. In fact, I'm eyeballing these things sitting on the table here.
We're ready for you.
She made these.
I baked.
Oh my goodness.
No, there's so much here. So can I start with mine?
You go first.
Okay, so because they're
Yikes.
homemade.
Okay,
So-
for listeners, she's a big bag is on the table now.
Yes, there is a large bag. You have to understand too that I love to bake. So when you said sweets, you had me because I love the challenge of baking.
I just see more and more stuff coming out of this
There's,
bag. I'm
there's
getting very
so
excited.
there's so much.
So Ellen is removing brownies and cookies.
So the first is my
doesn't
family,
translate well to a podcast, but
No, but my family has sort of some endearing terms for these brownies, but they are very special brownies that so that's the first treat for you.
Thank you.
And
Keep
then
sliding them over.
Yes, and my son helped me with these.
what's
by
the
way.
endearing
So-
term? They're crack brownies.
Yes, but I wasn't sure if we wanted to say that on the podcast.
Well, it's not real crack.
I know, but like I don't know. Okay, so we call them crack brownies, but actually, the connotation as to why I didn't use that. They are truly called crack brownies because you let them crack on the top,
Right.
and that's how you know that they're done, but they're still gooey on the inside.
Right.
So that's it.
Fantastic.
Then this was new, but I'm very happy. These are all brown butter chocolate chip cookies. So you actually brown the butter that you use in
Yum.
the chocolate. And
Interesting.
these are Nutella stuffed.
Oh my goodness.
These
There's
are
so many options here.
These are non-stuffed, and these are fudge.
Look at the size of those things.
But well,
Wow.
let me tell you, when you stuff something with fudge
Oh.
or you stuff it, it's got to be a big cookie. So
Yeah.
there you go. So
Why
that's-
not? If you're gonna have
Yeah.
a cookie, make it big.
And so
this
then-
is awesome.
Yes, and then
Oh, it does.
Justin.
There's more.
Oh,
Yeah, that's-
But wait, there's more. So I went over to Reading Terminal this morning, first thing.
I recognize the bag.
for a sweets connoisseur.
Right.
Yes.
So, Ellen, I'm going to have you open this one because I got
So
her some
I'm a
gifts.
sweets connoisseur too.
Oh, great.
So
Wait, we're
But-
gonna open these.
well,
Well,
we might as well look and see what's in there.
Packages
so
are
this is a
so-
box.
but this
so
is for
fancy.
Nick. These, because you're a donut guy.
Yeah, those are Weilers.
Yes.
Yes,
He knows what they are just looking at the box.
absolutely. They are the best donuts. Bar none.
Really?
Yes.
What makes them the best donut?
One, I believe they use potato dough at some point. I could be wrong about that. Maybe I've made that up in my head, but it makes me
Potato
feel
dough.
like they're different. And then on top of that, the quantity of filling inside and the quality of the filling inside is second to none.
Well, I hope
Weilers
you enjoy
Amish Doughnuts.
the choices that I made. One of them's peanut butter and jelly. I don't know if there's allergies or anything, but
So I just opened my box, which is from Termini Brothers, the gold medal pastry since 1921. And there is a carrot cake.
a velvet.
It's so I guess I should do this for those that are watching. which
Don't
is just-
drop 'em.
I won't drop them.
Wow.
But
Carrot
there's
cake,
carrot
red
cake
velvet cake.
and some sort of
What's the other one?
chocolate,
Chocolate mousse.
like
Nice.
a chocolate mousse.
Welcome to the Betty Crocker
I don't know what
podcast.
these
Yeah.
are, but the woman at the counter sold me on them. She said they're the best one. They make the best ones. I don't know. Again, I'm not sure what exactly
So
they are. I was
I've-
on a buying frenzy. I was like Willy Wonka
Well,
this morning.
this is awesome.
So I have to say, I think we have to arrange some sort of. There's another
there's
thing
cookies.
in there.
There's more cookies.
What cookies do you have in there?
Oh man.
Oh, this is the 4th Street
Fourth
Cookie
Street.
Company.
Yeah. Familiar with those too.
Are you?
Yes.
Okay.
Reading
all right.
Terminal is a fantastic
So what do
place.
you? What
I got
did you-
peanut butter, and I also got
there's
chocolate
chocolate chip.
and I got one's blueberry cake.
Oh, and like a raisin.
And yeah,
Interesting.
Yes, and we do not condone eating all of this sugar and
Yes, we don't,
We are a
but
healthcare podcast.
This is so
I
exciting.
say baking podcast today.
Yeah.
Yeah.
So anyway,
All right. So I did say to the guys, I think we might have to figure out some sort of like follow up where we do it remote and you like tell us which ones you liked the best.
Yeah.
We want you on
Take
camera.
mental note, and then you can be like,
You will get a full written report.
I'm so excited
To be
by
on
this,
camera with every bite. Mm-hmm.
Yeah. Okay. All right.
All
Well,
right.
that was the fun banter.
That was exciting.
Notice that when I sent you the script, I didn't have any of that because I didn't want you to know that we were going to bring you treats.
No, this is awesome.
So.
This is yeah. I'm speechless
Well,
staring at all these things. I'll be thinking about
You're-
this the entire podcast.
So
of
then
getting
we're
me
like
to
distracting
eating.
you. Yeah.
So what else, other than sweets, any other outside of the office sort of interests?
I'll share a current passion. I have a little one at home, and my wife and I and our daughter, we love searching for fossilized shark's teeth on beaches. So I didn't really know this was a thing before maybe a year ago or so, and now we're completely obsessed with staring down, walking on the beaches, looking for them. Now that you see them everywhere. And it's
Really?
like, yeah.
Do you have one of those teeth detectors, like a metal detector?
No,
but for
I
teeth?
wish there was a teeth detector. I keep thinking about they should make like special glasses that take the glare off of everything else, and you can zero right in on the shark's teeth on the beach.
Sounds
You
like
write that
another
down.
business
Sounds like a Shark Tank.
Yeah.
Shark
So-
Have you
Tank
been to
episode.
Venice in Florida? Which Shark Tooth Beach? It's actually
A thing?
A thing, yeah. So anyway, it's just south of us.
Well, that's what I was going to
Wow.
ask you is if there are known places of particular density of fossilized shark's teeth.
Our first discoveries came along in the southernmost beaches of North Carolina.
Okay.
So that's where we had good luck so far and discovered this whole passion around searching for these things.
So is it gonna-
along with seashells too, just various size shells all in one piece. Things that we weren't as used to seeing in the northern beaches of the East Coast here.
Okay.
Right, because they're
All
always
right.
broken and you just find little shards.
He actually
Yeah.
said the word like Swedish dishcloth. The seashells by the shore.
Oh, say
Remember
it
we
3
had to
times
say-
really
yeah.
fast.
No.
No, we had to do that with we talked about a Swedish dishcloth, and we couldn't say it correctly, and it became sort of a joke. So it was funny that we
It's easier to
used
say
that
chamois.
parallel.
It's
Chamois,
a
yeah.
chamois.
All right, I'm going to be the
But no,
ruiner of
well,
fun
I have
if you
to
want to
just
hit the
make
button.
one. I know, but I have to make one last comment, which is that a classmate of mine growing up is huge into fossilized shark's teeth.
Yeah.
And she's always in riverbeds in Central
Yeah.
Florida, like searching for these. So
It's amazing stuff. The best find to date was finding a megalodon tooth, and it's like I didn't. This
Wow.
is
Like
millions of years old.
Oh,
these
you
days.
just
It's
found it.
Unbelievable. Yeah.
wow, that's
cool
super
stuff.
cool. That's super
Excellent.
cool. So, okay, so now the want.
Oh yeah.
Yeah, you gotta.
Yep. Unfortunately, we're done with the fun.
Wait, see, Justin was given a gift at this.
We had
'cause-
no idea that they had sound effects, so
Because the
I've been over
studio
here.
we record at in Tampa, we have no fun sound effects. So whenever Eric, the technician, he showed us these sound effects, it's like having
We brought
a
our own,
DJ.
though, just in case.
Yeah, exactly. There we
You
go.
know, somebody
So-
gets the boring button sometimes.
Okay. All right,
Um,
Dave.
so,
Set
yes,
on
This
each
one,
other.
since it's here.
Yep.
Yeah.
so we,
You can
So we
reach
had-
those. See, you can
Yeah, I know,
actually
you-
have a lot of
we
fun.
Could, we
so.
could go toe to toe.
Yeah, okay. There's lots of fun.
So I'm going to
buttons.
kick off our episode a little differently today. As you know, Nick, we always ask our guests what their buy the world a Coke or when pigs fly idea would be for fixing the healthcare system. So can you share yours?
Yeah, I mean, such a complicated question. You know, in my view, and maybe many of us out there, our system is broken. It's complex. It's difficult to navigate. It's expensive. The outcomes could be better. So it leaves a lot to be desired. You know, just thinking about cost as an example, there's so much waste and duplicity that happens in the system that we can do better. We can find ways to take out, I call it the low-hanging fruit that's in there, of taking some of the waste out. And then really if we found a magical solution, it would be trying to care for the 80% of a person's well-being that happens outside of the traditional healthcare delivery system, all the social determinants of health that we learn more and more about every day.
So that's a perfect segue. It's a perfect segue into our discussion today about how we can affect real change, with all caps, in healthcare, which is this podcast is our passion project around that, because I think as thought leaders, we don't talk about it enough. We kind of get in our lanes and we don't have an opportunity to sit around a table like this and have a conversation. So when we asked you that question around real change and the importance of it, you said, let's talk about improving the experience for the end user. You teed that up. And this is something that every industry strives for, right? Like if you talk to anybody in any industry, they would say, we want to improve the experience for the consumer. But when you talk about a broken system, anytime people ask me, well, why don't you just fix healthcare? I always actually talk about the consumer and the fact that it's a multifaceted consumer. There is not one consumer. It's not like when you go in the grocery store and you buy broccoli and you're the person that walks in the grocery store and buys the broccoli and leaves, right? There's this whole complexity. There's this litany of consumers. So tell us your thoughts on that concept, the complexity there.
Yeah, it's even the terminology, like we refer to the person differently based on where you sit within the continuum of our industry.
Yep.
And so you hear words like client, customer, member, patient, consumer. It's all different words that can be describing the same person at the end of the day. And there's so little that puts that person at the center of every decision that happens. And so it's another one of those areas where we have a lot of work to do.
Sounds simple, but it's real complicated.
So it sounds like we need a framework.
Yep, there we go.
I love a framework. These guys are like, oh boy, it's like me and the wearables. So I'm actually excited to be able to talk about this because I feel like this is the first time, and this is what, our 14th episode now? This will be our 14th episode.
Cool.
But we've not talked about
15th.
15th, sorry. 15th episode. Wow, sounds like a hefty number.
Keeps going up.
Yeah, it just keeps going up. But anyways, we haven't talked about the complexity of this and the term, the person, we need, when we talk about healthcare, I guess the first thing I want to make sure we all agree on is that the term person should be at the center of it all, regardless of from what angle. Like, do we all agree with that? If I use the word, because if I throw a framework out, we have to all agree on the idea that the person is at the center. You guys are nodding your heads?
Yes.
Okay, all right.
For the viewers.
Yes, for the viewers. So, okay, so let's take the framework further. So first we have the consumer or customer, right? Then we have, which can be defined as a member, which is the person who is getting health insurance, right? That's you as the consumer into purchasing health insurance. And then you have the patient, which is actually getting the health care. And so when you buy your insurance, let's start with the first aspect of that, which is when you buy your insurance or you shop for your health care, you're the consumer or the customer, right?
Well, yeah, this is part of the complication, right? We're really looking at four separate groups here. You have the individual buying the health insurance directly, the individual selecting the health insurance from the list provided by their employer, the employer choosing the health insurance for their employees, and then the broker consultant shopping for the health insurance plan. So you've got a whole host of different people in there.
And that's just for the consumer or customer buying the health insurance. Like, we haven't even gotten into when you're actually trying to use the health insurance or when you're trying to be the patient on the healthcare side.
Right, and that's just capturing what some in our industry would call the commercial segment.
Yep.
Right, and so it's not talking about the folks whose coverage or benefits are through Medicare at the federal level or Medicaid at the state level, or through the government in another fashion, whether it be military or TRICARE or something like that. Mm-hmm. But yeah, there's a lot of different ways that benefits are delivered, and that could impact how we're defining that person in terms of their consumer, customer, member, et cetera.
I don't know. It sounds pretty simple to me. Not. I'm kidding. So, Nick, any thoughts on how we can simplify or improve the experience of shopping for healthcare?
Yeah, human-centered design is a practice that's been around forever, and I think we need to deploy more of it in our space, right? And And so it's putting that human being at the center of what we do. And if you're thinking about that person as a patient, for example, then it's putting them at the center of what that experience looks like as a patient when they're seeking care. If it's when they're purchasing insurance as that individual, then it's what does that purchasing experience look like? How can we simplify the terms and ensure that we have the right level of health literacy in what we're delivering? So there's a lot of different ways, but I think at the core of all of it is if we deploy human-centered design principles, it will behoove us to create a better experience or enable us to create a better experience.
So how about like for the employer or consultant broker? Like, can you kind of go over that experience?
Sure. As a still someone who identifies as a broker from long past history, you were mentioning your collective years of service. This year is 31 for me in the industry, but the overwhelming majority of that before this tenure at Highmark was in that distribution space, in the broker space. And so, that person needs to be included in the process of the design as well, because they're guiding, oftentimes a broker or consultant is guiding an employer with the purchasing decisions of what plans to put in the list for their workforce, impacting their workforce and their dependents. And so we need to think about how do we make it simpler and easier to make those choices.
Yeah. So it's interesting because we had a guest, a few episodes ago, Mike Barrett, and his thought about real change in healthcare was he believes that we will be very shortly seeing kind of the elimination of employers carrying that burden of selecting health plans. He believes that the tax benefits that have driven that are not proving to be really worth what that creates, right? The complication it creates for employers, the cost, et cetera. And so he believes that employers are going to largely kind of step out of that role. And what you were talking about before when we talked about individuals selecting healthcare like on the exchange or Medicare or Medicaid where there is no broker involved, I don't necessarily agree, but it was an interesting conversation to have that, his point was that's going to create a direct to consumer 2.0, because it changes the consumer experience from a perspective.
Well, it's one of the things when you think about the complexities and how to solve. Such a large percentage of our population in the U.S. are covered under employer-based plans, and so the different changes that some ponder that look to kind of completely change that. It's such a big change to talk about. I'm a fan of incremental changes and achievable changes. And that's such a big one to alter the way that care is delivered for, on any given day, roughly 60% of the population. So that's a difficult one to pursue.
we called it the cataclysmic change.
Yeah.
I don't think people are educated enough to be able to be informed enough on the decisions that they don't understand, to your point, the health literacy aspect. If you turn something over that's so complicated, that there just isn't something there unless the broker becomes part of that equation somehow. And how are we funding that?
It's like saying that real estate agents are just going to fly away.
Well, look at MA. I mean, seniors have
Medicare Advantage.
Yeah, Medicare Advantage. They have a heck of a time trying to figure out the hundreds of offers they're getting in the mail.
But
you
have counselors that are available to be able to help assist in that. But that doesn't exist necessarily in the commercial space. Which
is why we talk about the consumer experience, right? So, all right. So back to we could talk the entire time, I think, about that piece alone. But back to my framework. Let's now move on to the consumer or the person as the member. As the health insurance member.
Sounds like we need a definition here.
Oh, boy.
We're always doing
definitions.
There's no
Wagnall.
Ellen's always looking up. This one is as simple as it sounds, was actually not that easy to find, but in the medical dictionary of the free dictionary by Farlex.
Yes, that's a thing.
I know. Who knew? The definition, a person covered under a health plan, either the enrollee or eligible dependent.
which was very apropos. So my point is
Exactly.
you could find member, a lot of different definitions of the word member, but the only one that defined member in the healthcare industry was that. So, yeah.
Yeah, but what does that really mean practically? Like what does that membership give you? It's like a paid subscription of sorts.
Yeah.
Comes with healthcare services such as administrative services, those types of things. Nick, did I miss anything?
Even in the subset within the insurance world for a member, then we think about, is the member on a fully insured program, in which case then the insurer is taking on the risk of the medical bills in exchange for a premium, or is that member on an employer-sponsored plan that's self-funded, where the employer is actually covering the bills and the administrator of the plan is covering things like processing and billing and setting up a network of medical providers.
So what do you think the key ways are that we can improve the interactions here? Because this is definitely an area of frustration for a lot of consumers. Like, we have people that listen to the podcast that are not in the healthcare industry, but and this is why whenever Dave says MA, I always say Medicare Advantage.
Yeah,
because
fair enough.
you need an acronym.
Yeah, I do. We do.
Yeah.
But I mean, it's important to us that somebody who doesn't know the industry but wants to learn more about it, that this is a place where they can kind of learn that and consume it a bit. And I think it's important because people, to me, if you ask somebody, why they think healthcare is broken, they're, immediately go to health insurance. I hate working with health insurance, or, they're going to vent about that. And then the other thing they're going to say is, my doctor doesn't listen to me. Those are kind of the two pieces. So when you think about it as the insurance consumer, what are some of the key things that you're focused on that you think, or even not focused on, but that you think are opportunities for improvement of how to make it better?
Yeah, I think first we think about access and where are there needed access points to care. So if I'm thinking about it wearing a health plan or insurer hat, I'm thinking about, is our network robust enough that folks can access care when they need it, and do they know where to go to get it? And how can we help facilitate that and have maybe some would refer to it as care navigation, to find the right care at the right time, at the right place in a highly efficient manner that has the best outcomes. And so I think about access being a core. And there's so many, in the healthcare industry, there's just like many industries, there's so many workforce shortfalls right now that access is an issue. And if you go to some parts of the country, even not that many miles away from different parts of the country, the access is dramatically different. And so how can we improve that? And so a lot of the initiatives, you were kind enough when talking about some of my background, you mentioned blueprints for the community, and workforce being one of those things, and upskilling workforce or attracting new workforce. We've tried to do that in Delaware around some of the areas of greatest need. And I commend our health systems in the state with residency programs that they've developed to try and bring in new workforce, specifically around family medicine and surgical care, different things that were needed quite a bit.
In fact, our guest before this was a product of the Delaware residency system. He was a medical resident at Christiana and Nemours and in internal medicine. So to your point, he was a somewhat of a product of that. Any other areas as the insurer, when you have your hat on truly as the insurer, that you all are doing or you see in the industry that really display improving the experience for the consumer?
Yeah, and so it's not always about tech, but where tech can help too. So virtual access to care, particularly relevant during the pandemic when folks were sheltering in place. But even beyond that, care like behavioral health, and seeing the percentage of adherence to visits that happen virtually that remove some of the stigma that would have been around in-person visits for those things, or scheduling time out of the day to do it. Virtual specialty care like MSK, I'll throw an acronym buzzer at myself there, musculoskeletal, right? So things of that nature, where can we enhance those? So I know health plans like ours, we think about that all the time and what products we can deliver as part of the insurance package that improves the experience. And again, thinking about that person at the core, what do they need? Is it improved access? Is it facilitated access? Those kinds of things.
Right. So to go back to the framework, so we've covered consumer, customer, and member. So let's jump into patient.
I think this one's a little tricky because it's defined as a person receiving or registered to receive medical treatment. But there are so many ways to receive medical treatment, and it's disjointed. And yet, in the beginning of our conversation, Nick, when you talked about improved outcomes, this is the epicenter of that objective.
Yeah, it's so difficult. And you think about a patient who might be going through an acute situation in particular. Those are stressful in and of themselves, without factoring in how do I get to my care, where do I go for care, who do I go to see for care, does the place that I'm seeing for care coordinate with my family physician, and is that incorporating behavioral health into it, and all these different components. It's very tricky, and it's tricky for us to solve as an industry. You mentioned some of your audience being outside of our industry. It can be daunting when you're thinking about these things as a patient, and that's if you're thinking about it with a whole support system around you. If you're thinking about it exclusively alone, while also dealing with a health issue, it can just be overwhelming.
Yeah, it's funny. Now that this is our 15th episode, you do start 16th. To see some. Sorry, no, don't mess me up. You're gonna really mess with me. I'm like, oh yeah, 16th, but this care coordination is a theme now that is becoming more consistent in our discussions as we have different guests from different aspects of the industry to talk. And just now we talked about the importance of the coordination of care and including all of these different ancillary services like MSK, like you said, the musculoskeletal, behavioral health, that we call those ancillaries. And as an industry, we've sort of thrown them off to the side. They're like bolt-ons. But the truth of the matter is, to us as patients, they're just part of our healthcare.
That's right.
And we need to acknowledge that from the person's perspective, which is why we're talking about how to improve the experience, we have to put our person hat on and say, I'm the patient. So clearly we've created this seemingly insurmountable complex system. Do you think there's a secret sauce to this that's sort of a common thread?
I do. I think going back to keeping the person at the center of everything, I think it's all about relationships. And I have this core belief that if we can improve experiences, we will improve engagement. And if you can improve engagement, you can improve outcomes. And with improved outcomes comes more cost predictability and ultimately affordability. And so it's really keeping the experience at the core, and the relationship of all those pieces that we've been talking about are really inclusive of relationships of people. And that's a secret sauce, is how can we improve those relationships?
Well, meaningful relationships are truly at the epicenter of it all for me. I mean, that's when Justin and I first had the pleasure of meeting you a few years ago, we appreciated the genuine nature of our conversation with you. It was a very, an interview of an executive to get background information isn't exactly necessarily a warm and fuzzy type of experience setup. But we broke bread together and we got to talk to you, and here we are 4 years later with you on the podcast, because it was in fact a genuine interaction. So I couldn't agree with you more about relationships.
Yeah, and that really hits home for us because it's at the core of who we are, the three of us, and it's at the core of our BP2 mission as well. There's actually a line on our website that reads, Because actionable solutions are the direct results of respect, you'll come to know we believe in relationships too.
So it is interesting. I'll go off script for a second, but when we meet somebody like you, right, we think to ourselves, how do we strike while the iron's hot so we're able to achieve, what normally you wouldn't be able to achieve with other people,
Yeah.
if you understand what I'm saying that way. It seems like an apropos moment to do the Buy the World a Coke idea.
Are you going to sing?
She makes us sing every time.
I know.
Because you
I
have
know.
such good radio voices, and then you
I
can
don't.
sing. I cannot sing, so I like to hear you sing, Dave. Dave.
I'd like to teach the world to sing.
Perfect time.
Perfect. Come on, harmonize with me.
No, I can't.
Like to
Really?
buy the world a Coke.
Yeah.
Keep it
Sorry.
company and keep it company.
Yeah. We waxed poetic there for a while.
I can't sing. My dad had all the musical talent in our family, not me. But my grandfather worked for Coke for the longest
Are you
time,
serious?
which I
idea.
didn't share in our background there. So
Are we going to get sued for doing this on all of our
No. Big Coca-Cola fans are our family.
Coca might come after us. You never know.
No, I think they would appreciate what we're
So what is
trying
your
to
Buy the
accomplish
World a
here,
Coke
so.
moment?
Yeah, it's definitely those relationships. So, the big, I've had a very fortunate career, and it's been an interesting ride for me personally. You mentioned some of the entrepreneurial past, and then this current ride at a health plan, and the privilege of the position I get to hold right now. But it's all been about relationships, and some of the biggest successes came from really what maybe started as adversarial relationships in our industry. And I look at an example where a health plan with a lot of market share and a health system with a lot of market share were kind of butting heads with each other. And from the outside looking in and thinking of myself as an advocate for clients or customers and all those different words we talked about, I was watching those negotiations happen. And it looked like an arm wrestling match where somebody's going to feel like they won and somebody's going to feel like they lost. And ultimately, the person that was mutually being served by those organizations always lost. And so I said, couldn't we do something differently? And it would be awesome if we did. As a worst case scenario, so the Buy the World a Coke moment is, let's try. Let's try and do something different, and as a worst case, we'll learn a whole lot. But as a best case, we might be able to create a replicable model that others can learn from around the country. Because if we go back to the person at the center of everything, I believe that our mission and visions aligned. It's to help that person. A system might call the person a patient, a health plan might call the person a member, but it's the same person. And that we're trying to help. And so if we can get to a better experience for that person, it's mutually beneficial. And now the tricky part is trying to figure out how to align all the economics around that in a system that's very disjointed today.
So,
that's value-based care. I just have to put a plug in there for the old value-based care piece, because that to me is the glue that binds everybody together financially. It obviously has to be done in a way where it doesn't feel like somebody's passing the buck to the other, because that gets more into the arm wrestling. But when everybody becomes financially accountable, and then a different level of partnership occurs to really join forces to align around improving outcomes. We talked on the episode before this, Dr. Elliott mentioned managed care, and he was talking about it from like the 90s, the early 2000s, when managed care was health maintenance organizations, and it got the bad rap of care, basically care avoidance, withholding care, right? But now I feel like we are in an era where value-based care really is about improving outcomes, improving the experience for the patient, and to your point, it's also the only way that we can focus on the 80% outside of the healthcare system.
That's right.
To really, obviously we can't be enjoying sweets like we,
Yeah.
I just put out in front of us if
We've
we
been
want
talking about
avoid lifestyle disease.
Well, to the dismay of my Coca-Cola family, I'm water only.
Yeah.
So I try to offset examples like today. There'll be some binge today.
Yes,
We
yes,
talk
yes,
about
yes.
food as medicine, food is health all the time, and we got all this.
Yeah, and then here I am bringing you all that. But you have to have it's all in moderation, and so. Anyways,
Well, our last question, and it very possibly ties into your Buy the World of Coke moment, is what legacy would you like to be a part of in healthcare?
Yeah, I mentioned before that I have a daughter, and it's a burning desire in me, kind of like the simplistic, leave the world a better place in some way. Mm-hmm. I want to leave it better for her generation and generations to come, and just to have any kind of part in that would be awesome, even if the part is learnings of what not to do. I want to, if I had a legacy, it would be a willingness to try and to try things differently. Coming into this job and this role was a leap, even though folks outside our industry would say, oh, it was all insurance. You were at the insurance broker side, and now you're at a health plan side. It's very different. But it was a leap to say, maybe I can do something here and be part of something bigger than myself. And that's the passion. And so the legacy is just to try to make the experiences better. And Ellen, you mentioned value-based care, and we talked about all the people, customer, client, member, patient. What we didn't mention is the person delivering the care, who's part of that equation too. We need to make the experience better for that person. And that's something our industry can do a lot better of. When talking about that waste earlier in the system and the distrust and the duplicity that happens, we could spend more than one full podcast talking about prior authorization, I'm sure, and all that.
I actually had that written down, and then I was like, oh, I don't want to put him on the spot about that one.
Yeah, no, it's okay.
Oh, that would be boring. Yeah, but people would understand it.
Yeah. But it's that would be my desire, is just to leave something better than I found it. Kind of.
Well, you've described what I always call my unicorn client. So I always say as I kind of come into this last probably decade of my career, I really am excited for us to work on that type of work that is really taking a risk. That's stepping outside of, so it's that balance of incremental and cataclysmic. And to say, you know what, this is the lane I've always been in, this is the way we've always done it, but it's not working. And instead of everyone standing around waiting for Apple or Amazon to come in and disrupt it and turn it upside down, there are so many smart, thoughtful people in this industry that if we just started that conversation and connected with each other, like even today was really nice because typically we're in a place where, like, this was great because the three guests that we had today, by us coming here, you all are in the same geography with each other. And I thought it was really cool to connect each of you personally with each other, because we view all of you as the types of thought leaders that can do something different. And so it's exciting for me to see coming to fruition that, yes, we are talking about it and bringing a voice to it, but then seeing it happen in real time. And it's the unicorn. Justin's like, oh, here we go with the soapbox. So anyways, so thank you.
It's the megalodon tooth.
It is the megalodon
once in a while.
tooth. It is. So
Thank you so much for your time, Nick. We appreciate you coming out.
Yeah, thank you guys for having me, and the sweets. I can't wait to give you the full report.
yes, we'll have to figure out how to be creative about it.
I am curious the ratings on
on
what
the
I picked
donut.
out.
See, I have to digress for a second and say that I can't do donuts anymore. They leave that, like, I have kind of a
You sound like
weird
me and pizza.
textural diversion.
But these ones have, what'd you say, potato?
Dough.
Aversion. not
Again,
diversion.
I'm if anybody's watching the podcast that knows these donuts, I'll probably get criticized. They're not potato dough, but in my head, I think they are.
Is it called Byler's?
Byler's.
Byler's.
Yeah,
Byler's Donuts.
Amish.
And just for the record, I have to say that there is apparently a large Amish community where Justin lives in Florida and Sarasota. And his original plan, and you may get a gift in the mail, his original plan was to get your favorite filled Amish donuts and bring them to you from Florida so that you could compare and
It's
contrast.
a place called Yoder's. There's several, but
But
yeah.
what happened?
Yeah.
Why you couldn't pull it off?
Because he forgot.
You
and
failed.
It was, yeah.
You
So
forgot.
I'm just gonna
He
say
forgot.
it's either another podcast episode or a gift in the mail.
It's a good way to entice entice me back.
Yeah.
You could come down to Sarasota anytime.
Yeah. And look for megalodon teeth.
Yes,
There you go.
Venice,
And
yep.
go to the beach.
Fantastic.
And, so thanks again, Nick. I really appreciate this.
Thank you.
I'm Ellen Brown.
I'm Dave Pavlik.
I'm Justin Politti.
We are the part.
Justin, come
Tag,
on.
you're in. We are the partners at BP2 Health, your best chance for real change.
As you can tell, we could talk all day about healthcare. Drop us a line through our website, bp2health.com. And the Reverse Mullet podcast was produced today by Mainline Studios in Westchester, Pennsylvania.
And they've been fantastic as a guest studio today.
Give Jerry a shout out.
Jerry.
Give
Keith.
Eric.
Keith.
Give Eric.
It's
You
Keith.
too, and the names. I normally can't
Kevin.
remember
No,
the
it's
names.
Kevin.
It's
I know,
Eric.
I know.
Eric.
Call
I
Eric.
know.
I was
Call
joking.
Eric. So, all right.
All right.
Thanks.